Hey everybody, this is Eric with Motion Guidance, and thank you so much for joining me again today for another installment of our Healthy at Home series. So I'm in my basement and I have my patient pack set up and ready to go, and today's topic is going to be dealing with vestibular ocular reflexes, or things around the eyes and the head. These symptoms often present during conditions like concussion or whiplash associated disorder, or even with brain injury, traumatic brain injury, or TBI. So I had on the docket today to take you through 5 things that you can easily work on from the comfort of your own home. And those are going to be smooth pursuits, vestibular ocular reflex, VOR cancellation, saccades, and joint position sense errors or awareness in the head neck area. Okay? So if you have our patient pack, you're going to have this flag available to you. You're going to have a large strap, a perpendicular mount, and the ball and socket laser that comes with the kit. All right? So today I'm going to take you through these 5 things from the seated position, but you could also do these in the standing position if you wanted to. Okay? So we're going to take the large strap and we're going to floss it through the buckle where the blue field is on the outside. Classically, when you're dealing around the head, you can just go ahead and shorten this up all the way. It is elastic, so it should fit on your head comfortably with some give. And then you just take the teeth that are on the back of the mount, slide those into the blue field, and you're ready to go. All right, so I have a stool here. And let's go over this first exercise. So I mentioned smooth pursuits. Now for this, okay, we're going to be centering up the laser on the middle of the target. And of course at home I want you to sit right in front of the target, but for this video you'll see me off to the side. So I'm going to put this on my head, and it doesn't matter exactly where the laser is positioned, because I just want you to sit with a nice upright posture, okay, focused on the center dot, and then you can reach up and turn the laser on and have that centered onto the target there. Okay? Now for smooth pursuits, this is working on your head remaining still and your eyes fixating on something that might be moving. So we're going to use this butterfly or flower pattern on the outside, where I'm going to be moving my eyes tracing there, but I want the laser to stay focused on the middle. So I'm going to turn this back on, center that up, and I'm going to keep the laser in the middle so my head's not moving, and I'm going to be tracing the outside pattern with my eyes. All right, so I'm on the lower right field. I come back to the middle, I trace the lower left field, come back to the middle, trace the upper left field, back to the middle, and the upper right field. Okay? Now I can go back around and do the inside darker pattern in those same fields, not moving my head. So what you'll see sometimes is that as you're moving a certain way with your eyes, the laser will start to move in the same direction with your eyes. And that's what we're trying to reduce, is we're trying to reduce the amount of head drift as your eyes are working through space. Now, we recommend you go around the pattern of each colored area 5 times, one direction, and then 5 times the other direction for a total of 10. So one's going clockwise around the pattern and one's going counterclockwise around the pattern. If you want more difficult challenges, you can start to move your eyes slowly up toward the upper corner targets, okay, the upper middle target, and come back to the middle, the upper left target, the middle left target, down to the left, and come back, going around the outside of the flag, or you can even trace the outside of the flag itself while keeping the laser in the middle. Okay? Our next exercise is going to be called vestibular ocular reflex. Now what this does is it allows us to have the head be moving while the eyes are fixated on a target. So we're going to use the inside target this time to fixate on with our eyes, to focus there. and we're going to be moving the laser back and forth between the two targets on the outside of the center horizontal line. All right, so this is what that's going to look like. So I'm looking at the center target, I turn the laser on and I center that up, and I'm going to keep looking at the center target while I move the laser between the outside targets on the center horizontal line. Now, if you have a metronome on your phone, normal for this is 180 beats per minute. So I'm going to show you what that might look like. It's going to be fairly rapid, but it's going to be back and forth like this in that no-no pattern. While I'm still looking at the center target. Okay? Now, if you want to look at the center target up here, you can do the same thing with your head and extension. If you want to look at the center target down here, you can do the same thing with your head inflection. Going back and forth between those two. Okay? If you want a tougher challenge, you can always extend out on your wall a further trajectory of the laser while you're looking at the center target. Okay? We recommend going for 10 seconds at a time and trying 10 repetitions of those for VOR. Next is going to be VOR cancellation. This is actually going to be working on some cerebellar function, or that part of the brain that's down toward the top of the neck. All right? So what we can do for VOR cancellation is we can have the head and the eyes moving through space at the same time. So we can actually trace a pattern on the flag, watching it with our eyes. At the same speed that our head is moving. Okay? So technically, my head and my eyes are doing the same motion as I go through space. Okay? There's no movement differentiated between those two. You can go around the outside, lighter design on the flag. You can go around the inside one. Go each direction, clockwise and counterclockwise, and do those 5 times each. Okay? You can work on precision with this exercise with VOR cancellation, where you don't want that laser to move outside of the line. And of course, you can also work on speed, timing yourself to see how fast you can complete one time around the flag, or up to those 5 times that are recommended earlier. All right? So now let's move on to saccades. Saccades is the ability for your eyes to shift between objects in space without moving your head. So we see this a lot with concussion and whiplash, where the ability for people to be able to move between objects is impaired, and this is significant. Oftentimes what people do is they do what's called a motor cheat, where they are moving between objects with their eyes, but their head is actually coming along with them, and they're trying hard to minimize that, but they don't know if they're actually moving their head. The motion guidance device is a wonderful tool for people to be able to understand if they're moving their head while their eyes are shifting targets. You can do this on a horizontal line, you can do saccades on a vertical line, up and down, and of course you can work on diagonal targets. So let's go through those. So once again, I assume a nice upright posture, and I'm going to be looking at the center target to start. I turn my laser on, and I move the laser on the ball and socket to the center target. Okay? So that's my starting position. Now I'm going to move as quickly as I feel comfortable between the 2 outside dots. So I'm going to move to my right, left, right, left, right, left, going back and forth. After I complete 10 times each direction, I want to come back and see if my laser has moved. So oftentimes the deficit side will show up as if I move right, and the laser will start to move right also. Or it'll move right and then come back to the middle, instead of staying still the whole time. Okay? That was for side to side. We can go up and down. I can keep the laser centered, and I can look to the top, and I can look to the bottom. Look to the top, look to the bottom. A motor cheat would be the laser moving and following the eyes as you're looking up and down. And you want to try to minimize that or eliminate it completely the best that you can. Okay? And feel free to progress to the outside targets and diagonals, up and down each side. Okay? Or do saccades with your head in a slight bit of extension, going to the upper right and left targets, or saccades when you're in a little bit of flexion, looking toward the right and the left target while the laser is not moving. Okay? Another increased challenge would be to turn the flag horizontal, so your targets would be further away from each other, or you can always move closer to the flag to get that distance to improve. This is really significant for daily functions, and one example that always comes to mind is driving. You need to be able to be scanning the road back and forth, looking at different objects, distancing their speed, understanding some prediction of how they're driving and maybe where they're going. All that integrates into a lot of different reflexes into the brain, and a lot of people after these concussion and whiplash associated disorders have difficulty driving. So go ahead and take a look at these and see if it's something that needs to be worked on. So finally, let's talk about joint position sense error and training using the motion guidance device. Joint position sense error is the ability for your head and neck to understand where it is in space on a consistent basis. So what we're going to do is we're going to line ourselves up 3 feet from the center target. Okay, so that's going to be this middle target right here. After sitting 3 feet from the target, we're going to look at the middle and turn the laser on, and then center the laser up inside the bullseye. Now we're going to do 3 preparation repetitions by taking our head and neck through full rotation toward one side. So in this case, let's just go to the right side. So I'm going to look as far as I can to the right with my eyes open, and I'm going to come back and have the laser be in the center of the target. I'm going to do that 2 more times. One final repetition here, as far as I can, and come back. Now I'm going to close my eyes. I'm going to look to the right, come back to where I think the center is, and then I'm going to open my eyes. If the laser is outside the circle, that's considered an error. For you to have a diagnosed joint position sense error issue at the head and neck, you need 3 out of 6 of these to be outside of that circle. So you're going to do 6 repetitions, looking for how many are inside or outside. If out of those 6 repetitions, 3 are outside the circle, we recommend training this in different ways. So you can just start to train it by performing the test over and over. Eyes open, looking to the right, 3 times coming back, and then just do 10, learning from each repetition. Eyes closed, come back. Oh, that was inside the circle, but it was a little high, so I'm going to learn from that and come back. That was really low, so I need to come back in here. And I'm just going to go until I get the majority of ones inside that circle. Okay? Maybe one more. All right? And so that is telling me I need to really work on where my head and neck are being perceived in space by my brain. All right? And of course, you want to do that toward the left side also. And one side could be a problem and not have the other side be a problem. So look for that. Now you can progress this to doing it in standing. You can do this with a single leg stance for balance, or a tandem stance where one foot is in front of the other. And of course you can center these up in different ways of moving in diagonals, extension or flexion, okay? All to get a good idea and a good mapping of your brain of where you are in space with your head and neck. We hope these tips and skills help you with getting healthier at home, and join us next time.